Hello, friends. Welcome to the channel again. I am Dr. Aman and welcome to UK Dreamers. Today our topic is going to be how to get an NHS number. As you're aware, once you're in the UK and you want to get treatment from the NHS, so emergency treatment would be given to you if you have NHS, you don't have NHS number. But for a routine evaluation, for routine clinical stuff, the routine evaluations, medications, prescriptions, you need to register with a GP, that is a general practice. And along with getting into the GP, you need to have a NHS number. So this video is about how to get the NHS number and getting registered with the GP. Before I start a video, the disclaimer that this presentation is not representing the NHS and I'm not working on this video on behalf of the NHS. It is just to help the new immigrants to get the information about getting the registration and registering with the GP. So the first and foremost process that you need to have before you can go ahead and register with the GP is your BRP. So, if you have come to the UK on a longer term visas, for instance, a tier 2, tier 5, so you will get a BRP. This is usually collected from the post office or the letter that you get along with your passport, the visa. There's a letter and there's a mentioned address on that letter from where you can get your BRPs. So once you have a BRP, it's a fancy looking card. If you see the backside of the BRP, you can see that there's something written as NI number, as you can see in the presentation itself upon the red arrow. So the NI number is your national insurance number. If you have this NI number, then only you can go ahead getting your NHS number. So national insurance number is a little different. The NHS number is a little different. So you have your national insurance number, that is your BRP now. So wherever place you're staying, see, if you're staying at a hotel, like once you've arrived to the UK, that's not the right place for you to go and find up a GP. Once you've moved into a rented a property or like you've taken up some accommodation, then you simply go to Google, search general practice near me, or this is also known as general practitioner or GP surgery. So you just have to search GP surgery near me or general practice near me, and there would be usually 2 to 3 GPs that you would at least find near your address. So ideally, you need to go to the nearest one from your current address. What you can do is you can click upon them, you can get their number. You need to call the GP surgery. You need to ask them whether they're taking new patients, and yes, if they say so that they're taking new registrations, you would later need to visit the GP surgery and get yourself registered. Usually, if you call the GP surgery and if it's been taken up by the secretaries or some of the nursing staff or the healthcare staff, they would give you a tentative date or time to visit the surgery. You would go to the surgery, you would get some registration forms in which you'll have to fill up all your details, your name, age, date of birth, and all your previous medical conditions, allergies, anything that should be a health concern into this new system needs to be notified them via this registration form. So once you've filled up this form, you need to drop it again back to the surgery. Usually you can go and fill it outside. Else, if there's something you need to come back in, like if you're traveling with the family, of course. So you need to fill it for all the people, not for yourself, but for everyone, because sooner or later you will need to get into the system, and the better it is the earlier you start with. So once you have filled up the form, then you will be given an notice by the GP office that you would be getting up a telephonic call, and mostly these are being done by the nurses or the healthcare assistants, that they would be giving you a call on like basically it's a verification call, plus they would be discussing a little about your health, as I said, your past medical conditions, your drug allergies, or anything that you are really concerned of. So what I would like to add here is, if your partner is pregnant, What you need to do is, once you have registered yourself on the written form, you need to tell the nurse or the healthcare assistant or the secretary that your partner is pregnant, or if you yourself the presenting patient and you're pregnant, you need to tell them that you're pregnant. This will do what? This will, things make things streamline a little fast as compared to the routine ones, because then you need to get the midwives, and yet then you need to get the whole maternity system activated. I'll post another video on that soon. But as I said, if you're pregnant, do tell them, they'll process things fast. If you're not, you need just routine stuff, just tell the nurse. And once they have had a conversation with you, they would further process your GMC number application. So, what do you do after you had a chat with the one of the healthcare workers? You need to wait. See, this could be 2 weeks, 3 weeks. We never know. I got it around 17 days, so it is usually around 2 weeks time. So once you have received the letter of registration, look for a 10-digit number, as you can see on the screen. So the NHS number is usually a 10-digit number. So once you have that number, please, the best thing is always keep it with you, so you can save it in your cell phone, or like take up a photograph of it or anything. In case you need it in emergencies, it will definitely help you out. So once you have received your the NHS number at your mail, see, this will not come to you via email. It would be a hard copy. So keep checking your mails. UK is a country which still believes in sending hard copies and hard forms. So keep checking your mailboxes. You would receive it. And once you've received it, you need to call the GP practice for an appointment if you need one. See, it's not compulsory for you to have a GP appointment once the NHS letter has been received by you. If you have the NHS letter, it is definitely with the GP practice. So they have already received a copy, like you've received, they also have a copy. So they know that you are registered with the NHS. So in case, for instance, you have some health conditions, for example, you simply have any acidity sort of stuff. Okay, so you need to call up the GP. They would give you a slot. The tricky part with the COVID times is they would just take the appointments from 8 to 8:15 in the morning, like for you to book up the slots, and then you would be given a definitive slot, and then you would have consultation via online, as the previous slide was. Oops, sorry. So the you can have usually a video call or a audio call. The face-to-face interactions in persons are not happening in the COVID times. I guess once the COVID time is over, it will be definitely back. So you need the GP's permission for getting prescriptions or getting further advice, like you need any blood samples or anything. It all goes through your GP. So the GP is the single point of contact for any healthcare concerns which are not emergent or urgent in nature. So, why do you need prescriptions? If you go to randomly in the UK, if you go there, pharmacies available. If you go to the supermarkets, you can get a lot of medications, multivitamins, paracetamols, ibuprofens, painkillers, and everything. But be assured, you will not get an antibiotic, even though you are a doctor and you know that okay, this is the antibiotic. Say you're having some respiratory infection or something, you know that amoxiclav is going to help you, but you cannot go and directly get it from the pharmacist. You need to have a proper prescription, because if the GP is prescribing you an antibiotic, he has a very solid reason, and then that will be free to you. Okay, if it comes through the GP, it will be free. You won't be paying for it. Now, for instance, you go to a dentist and they say you have a small abscess or something. They write up a prescription. You take that prescription, go back to the pharmacy. You would still be paying for those antibiotics. The better way is always go through the GP. Other things that you can't randomly get, like for example, steroid intranasal sprays or something, like if you have some allergic rhinitis or something, you need mometasone or something, you will go to the pharmacy. They won't entertain you. So you need prescriptions. So there's a system in place here. It's better to go along with the system rather than fighting it out. So that's it. That's simple. So that was all from my end, friends. Our channel is UK Dreamers on YouTube. So do subscribe to the channel, do share with your friends, and we'll be back with a new video soon. Thank you so much. Take care. Cheers. Bye.